Hello everyone, welcome to Dr. Kim's Dental Radiology channel. Let's take a moment to look at this periapical radiograph. In today's video, I'm going to show you why it is so important to recognize anatomic variations before your implant treatment planning. So looking at this periapical radiograph, we have multiple teeth that are grossly decayed with missing crowns and large carious lesions. And again, how confidently can we identify the mandibular canal? So I think most of you would probably choose this as the mandibular canal, and I would agree with you. Let's see if I can pull up another radiograph. Well, this is not a very good one with a large cone cut, but again, the point is how many canal do you see, or if is there any signs of normal variation in the size and shape in the course of this mandibular canal. And your answer should be, we can't tell for sure, it's uncertain. I think that's how I would assess, right? It looks, for the most part, it looks normal to me. So now fast forward a couple weeks, these teeth are extracted, given some time to heal, and now we have cone beam CT scan of this area. So what I have already done is I've rotated the volume such that I can capture the course of the mandibular canal in a single slice as best as I can. But then pay close attention to what's happening to this canal. So right about this point, there is actually a separation or bifurcation of the canal into a major branch and a minor branch here, which courses anteriorly. So let me scroll buccolingually a little bit. So do you see right here, there's actually separation of the canal? And if I move forward, it's a little difficult to follow, but this minor branch bifurcates once again to have another branch that courses superiorly to something like this, such that it exits at the alveolar crest, and then another branch that continues to go forward anteriorly to merge with the main branch. So let's see if we can try to capture that. So right here, do you see this canal exiting right at the alveolar crest, right? And that's continuous with this line, and then another line that courses anteriorly. To merge with this main branch, and there may be even another branch that's coursing this direction as well. So did we see that on periapical radiograph? Absolutely not. But is it important to recognize this? I think the answer is absolutely true, because if you're planning on dental implant at this site, which is what our plan is at this point, normally you want to measure from the alveolar crest to the superior outline of the mandibular canal, but because of this neurovascular bundle or bifurcation of the mandibular canal, now we want to be safe and give a measurement from here to here. Let's see how much of that difference is. So this is my gross measurement. So that's about 12.2 versus 15.8. That's almost 16 millimeter, a difference of 3.6 millimeter, right? So almost 4 millimeter of difference, and that's pretty drastic, right? If you measure the ridge height to be closer to 16 millimeter, that means you can give yourself 2 millimeters of safety margin, which means you can use 13.8 length of the implant or something shorter, whereas now with this measurement, you want to stay with the implant that's 10 millimeter 10.2 millimeter or shorter. So that's a rather drastic difference that you want to be mindful of when you're planning a treatment implant. Again, let's see if we can capture that bifurcation from this coronal view. So as I course anteriorly, I hope you see that the shape of the canal is already a little somewhat unusual, with the shape resembling the shape of an 8, number 8, instead of a perfectly somewhat circular radiolucency. And as I go toward anteriorly, right here is actually it bifurcates. Here is the upper branch. Here is the major branch. And it's a little hard to see where it rejoins again. But what I will try to show you is the pathway of the accessory branch that exits through the alveolar crest. So to do that, I'm going to have to move the volume a little bit. Let's see. So hopefully I can show you there's a canal that's exiting right at the alveolar crest. Right here, it kind of courses generally downward, and then it actually starts from that minor branch that we saw. So that's the main takeaway point from this this video, that there could be anatomic variations. So this is completely normal. It does happen. It's not common, but it does happen, and you can't generally see that on periapical radiograph. But taking a conium CT and having the interpretation skill to correctly recognize that is very, very important, as it may lead to potential mandibular nerve injury in this case, right? So that's what I want to share with you. If you like this video, learn something new, please hit the like button and subscribe to my channel, and I'll see you in the next video. Thank you very much.